Hi, I'm Dr. Mike Milligan. We are here at the second annual American Academy for Oral Systemic Health meeting at the Cleveland Clinic, and I have Dr. Yiping Han of Case Western Reserve University here with me. Dr. Han, thanks so much for being with us.
Thank you. It's a pleasure to be here.
Wonderful. Well, we're going to talk a little bit about a tragedy, really, that can happen, but you've published 2 articles about gingivitis or periodontitis and how it affects a fetus.
Right.
Why don't you tell us a little bit about that? The first paper was done when?
In 2006, it was published in Journal of Clinical Microbiology.
Okay.
And it was a case involving a pregnant woman at the Metro Health Medical Center here in Cleveland.
Okay.
She came to the clinic in preterm labor at 24 weeks. The hospitals did repeated amniocentesis to rule out infection, but they couldn't detect any infectious agents.
Okay.
But she clearly had the signs of intrauterine infection because she had a very high white blood cell counts and a very low glucose level. These are all diagnostic criteria for intrauterine infection.
Okay.
So the baby was born at 24.5 weeks and survived.
So preterm birth, but survived.
Right.
This one.
Right.
Okay.
So we took the mother's amniotic fluid and used a non-culture independent method. We call it a PCR for polymerase chain reaction.
Okay.
So we detected actually a lot of bacteria in her amniotic fluid.
Which
and
was a surprise.
Very much a surprise because it turned out to be a species that had never before been associated with intrauterine infection before.
Okay.
It's a species called a Burghiella.
Okay.
And it's a very common oral bacteria.
So it's common in the mouth, but not in the uterus or the vagina, where you would normally think this infection might come from.
Right, because the conventional belief was if the mother has intrauterine infection, the most likely source is from the vagina, so the bacteria just ascend.
Right.
But in this case, Burghiella is not part of the vaginal flora, but it is part of the oral flora.
Right.
And so using DNA fingerprinting technology, we found the exactly matching clone in the mother's oral flora.
Right.
And so this is a first case linking oral bacteria to preterm birth.
Now tell us about the second case, which was widely publicized in the media, where there was a stillborn.
Right, this case was published in 2010 in Obstetrics and Gynecology. This, the outcome was not so good because it's a stillbirth at the term, which is very sad because the baby was at term.
Okay.
And so the mother had an uneventful pregnancy all the way till 39 weeks. So if you know, 37 weeks is considered full term. She's very much at term.
Right.
And so she had a respiratory tract infection with a mild fever, about 100 degrees. And 3 days later, she felt the baby stopped moving. So she went to the hospital and did an ultrasound and confirmed the baby had already died. So the baby was induced, and then they did an autopsy, and they found oral bacteria again. It's a different one now. This time it's called a Fusobacteria nucleatum, which is another very common oral bacteria in the mouth. It was isolated as a pure culture from the baby's stomach and the lungs. So obviously the baby ingested the contaminated fluid, amniotic fluid of the mother. And then which caused the sepsis, because the autopsy showed that the baby died of sepsis.
So it appears again this came from the mouth, a different bacteria from the mouth.
Right.
And you were telling me that afterwards there were, you think it was a pregnancy gingivitis that caused this. The gums appeared fairly healthy.
Right. This is what's so surprising to us, especially when we saw it first time in 2006.
Right.
That this is such a dramatic case, we thought the mother must have very terrible gum. But when we examined her at postpartum, she had a perfect gum, like no inflammation, no bleeding. And but what she told us was that her gum bled excessively while she was pregnant.
Right.
So we concluded that she must have had what's called a pregnancy-associated gingivitis. So because of the hormonal change during pregnancy, the gum can inflame
Right.
very
The gums
easily.
become more inflamed.
And pregnancy, but it's pregnancy associated, so it means that after birth, the gum will
gums
restore to
get better.
normal, right?
Right.
So when you examine her at the postpartum, you are not going to find anything.
Right.
And so this is quite common. It affects anywhere between 30 to 75% of the pregnant population.
Right.
And
The pregnancy gingivitis.
Right.
Mhm.
And for the stillbirth case, it's the same. When we examined the mother
Right.
at 3 weeks postpartum, she had no gingival inflammation.
Right.
But she said that she had excessive gum bleeding during pregnancy.
Right.
So in both cases, I think that these women had pregnancy-associated gingivitis, which is a very mild form of periodontal disease. And normally people don't worry about it. Just say,
Right.
oh, it's mild and it's temporary, it will go away, don't worry about it. But here we are showing that even
It
these
is a
mild
concern.
forms can cause severe damage to the
Right.
fetus.
Right. Might be an indication that some of the newer tests would be indicated more frequently, like the oral DNA, where you can actually see the bacteria that are present in the mouth, the actual ones, as opposed to just looking at bleeding and not really knowing what is there. So that even in a mouth that doesn't look that bad
Right.
periodontally,
Exactly.
it actually tells you if there are certain bacteria, and there are only about 13 or 14 bacteria out of the several hundred in the mouth that are the causative problems, the bad bacteria. And some of these newer tests will tell you which ones they are.
Right,
and
right.
if you have them.
Absolutely.
In your mouth. Yeah.
Right. I think that with the technology we can detect
Right.
so many more bacteria. So the profile of periodontal bacteria is shifting.
Yes.
So we should definitely take a look at the oral bacterial load of certain species in the pregnant women
Right.
and see
Right.
if they correlate with the birth outcome.
So what would you recommend for all pregnant women? Would you recommend that they definitely have their gums evaluated by their dentist?
Absolutely. I always say that for women, even before they think about getting pregnant, they should see their dentist to get their gum in shape.
Right.
In fact, in the case of the stillbirth, the mother contacted me after this happened and asked me what to do, and my advice to her is to see your dentist, get your gum in shape. And then the good news is that she later had another pregnancy, delivered a healthy baby boy, and her gum bled a lot less during the second pregnancy.
Wonderful.
So-
Well, Dr. Hahn, where would we get more information about this? Is there a website, or is there, where would your papers be located? Where could we learn more about this?
I published a paper in Women's Health magazine.
Okay.
I think it was in July 2011.
Okay.
And the title is Can Oral Bacteria Cause Pregnancy Complications?
Okay.
So it described much of what we talked about today.
Wonderful. Are there any last things you'd like to say before we close, Dr. Hahn?
Just get your gum in shape and
Okay.
brush and floss, because if this is event that could lead to pregnancy complication, then if you just see your dentist once during pregnancy, it's probably not enough. It's a daily maintenance is the
Okay.
key.
Okay, Dr. Hahn, thank you so much for being with us.
You're welcome.
And for all
Thank
the
you.
research that you do. Yes.
Thank you.